everyone. I, Ishika Sontakke, with my co-host Ms. Maria Bhadri, privileged to welcome you all into the Health Talk series organized by the Student Council of Sadabai Raisoni Women's College, supported by SGR Knowledge Foundation and powered by Raisoni Groups of Institutions. It's natural for anyone trying to lose weight. Healthy weight loss isn't just about a diet or program. It's about an ongoing lifestyle that includes healthy eating patterns and regular physical activities. Once you have achieved a healthy weight relay on healthy eating and physical activity, you keep the weight off over the long term. Losing weight is not easy and it takes commitment, but if you are ready to get started, we have got a step-by-step guide to help you get on the road to weight loss and better health with Dr. Kedar Patil. We welcome you, sir.
Thank you.
Dr. Kedar Patil, a well-qualified and trained bariatric, hernia, and advanced laparoscopic surgeon in Pune, being the qualified and trained person in field of advanced laparoscopy, bariatric, and advanced Bariatric and gastrointestinal oncosurgery Dr. Kedar Patil stands apart from the rest. For the past 13 years, Dr. Kedar Patil has worked as SMB Minimal Access Surgery GEM Hospital, Coimbatore, gained proficient skills and knowledge in the segment. Dr. Kedar Patil pursued degree of MBBS from Bharati Vidya Peth University, Pune in 2005 and DNB General Surgery from Diplomate of National Board, New Delhi in 2009. He has completed a fellowship in bariatric metabolic surgery from Taiwan, GI oncosurgeon at Tata Memorial Hospital in Mumbai. He had achieved publications in JMAS, IJS, obesity surgery. He had also given presentations at international conferences, ISSO, Vienna and Dubai, IHC Delhi, PNZ, the AWR, Ampicon, etc., and national conferences at OSICON, MESICON, etc. He was also a faculty examiner for the SMAS Skill Course Fellowship in Minimally Access Surgery awarded by AMASI and also appreciated by President of Maharashtra State Indian Medical Association IMA for flood relief work in 2019. I welcome you, sir, in our Health Talk series on behalf of all. Sir, now without any further ado, I would like to hand over this session to you, sir.
First of all, let me thank SRWC College, Nagpur, SGR Knowledge Foundation for inviting me for this talk. And with my moderator Ishika Sontakke and coordinator Maria Badri has made good efforts to this session to come online. And I thank for this opportunity. To begin with, my job in the next 45 minutes of talk is to explain you all how do we as weight loss surgeons approach towards weight loss. So I'll try to make things simpler for you with this presentation. And I'm sharing my screen now. I hope my presentation is seen.
Yes, sir. Yes, it's visible.
Yeah, so I was trained for bariatric surgery at Taiwan and laparoscopic surgery at GEM Hospital in Coimbatore, which is my core specialty. And I'm attached to Apollo Spectra Hospital in Pune, and I have my own clinic, Precise Clinic in Pune near Sarasbagh. Coming to the topic of losing weight the right way, the first thing that you all need to know is what is an ideal weight. For this, there are parameters wherein something known as BMI. You must have heard of this name, but this is body mass index. It's a proportion of weight to height, what weight should a particular height person should have. So this is a rough index which indicates towards obesity. So for Asians, up to 23 is normal, 18.5 to 23 is normal. 23 to 27.5 is being overweight, and 27.5 and above is obesity. So it is important to know that for Westerners, the criteria are different. For Asians, the criteria are different because Asians are more prone for cardiovascular diseases and type 2 diabetes. A waist hip ratio of more than 0.9 or 0.8 and a waist circumference of 90 centimeters in males. That is, anyone who is wearing a 38 size pant is obese if he is a male, and more than 80 centimeters in a female. So these are the parameters of obesity which are applicable for Asians. If somewhere to ask what is my ideal weight, the simplest answer is your your height in centimeters minus 100. So let's assume someone is 5 feet in height. His height in centimeter becomes 150 centimeters. So 150 minus 100, 50 kgs is the ideal weight of this person. This is, a rough calculation, and body mass index is calculated by weight in kgs by height in meter square. You have many applications wherein you can just put in the weight in kgs and height in meters, and you will get a formula and an answer for this. It is very, very important to understand this basic concept because our entire management with regards to weight loss is based on BMI. Now, coming to obesity, people who are thin and normal, they have a perception that uh, obese people are lazy or they eat more, so they are obese. It's not the case. There are many socio-economic, genetic, social, and environmental influences which make a person obese. So, of course, there is fast food, eating disorders, lifestyle habits, but there is also genetics, environmental role, social influence, and lack of exercise. All this put together can make a person obese. So, uh, obese in olden days or maybe 10 years prior, people used to say that khate pite ghar ka hai. But to be honest, it's not the fact. Obesity reduces a lifespan of by 5.7 years and 7 years in females, and it increases the risk of type 2 diabetes, breast, endometrial, and pancreatic cancer. So, of course, these are the other effects that one gets because of obesity, be it diabetes, hypertension, osteoarthritis, joint pain, hyperlipidemia, hyperuricemia, infertility, PCOD. You all must have heard of this. Polycystic ovarian disease is secondary to obesity, and obesity and polycystic ovarian disease both go hand in hand. So obesity increases PCOD, PCOD increases obesity, and this leads to infertility, especially in young females. So along with the diabetes, hypertension, there is PCOD. Obese people have some element of depression. Daytime somnolence is because of snoring. So again, a myth I would like to inform that snoring is bad for health. Snoring occasionally, once if you are so tired, you're very tired and in deep sleep, once in a while is okay. But if a person is snoring daily, it is bad for his right-sided heart, for lungs, because there is carbon dioxide retention, which leads to cardiac issues and hypertension as well. Fatty liver, again, a very common finding that we are seeing in sonography these days is because the excess fat is deposited in the liver, which causes it to be fatty, which is a risk factor for liver cancers later on. So, endometrial breast, colon cancer, cardiovascular diseases, poor quality of life due to restricted mobility and loss of work. There is also discrimination at work that these people have to face. So it is just not being overweight or not being excess weight. There are a host of conditions that come along with obesity. This is a famous issue issued by Time wherein Wasim Akram was featured, who has type 2 diabetes. And in spite of being lean and thin, we Asians, since there is a tendency to have central obesity, there is more incidence of type 2 diabetes. And diabetes is not just about sugars. It leads to a host of diseases in the long run, including cardiac, neural, kidney, eyes, leg ulcers, and any person who has any disease along with diabetes, the risk of that disease increases tremendously. So, if a person is obese by a BMI of 30 to 35, his life survival is reduced by 2 to 4 years. And if it is between 40 to 45, it's reduced by 8 to 10 years. That is an impact of obesity. 40% increased in mortality due to vascular reasons, 10% for neoplastic reasons, and rest other reasons. So, what I'm trying to tell you all is being obese, even though if someone is not having any problems, this person is going to have problems in the future for sure. Now, coming to the treatment aspect of obesity, I'll be touching upon these aspects: the surgical, non-surgical options, and medicines, as well as diet and exercise. So, this is a giant wheel, you all know. So, what happens in traditional weight loss means diet and exercise, to be particular. Of course, there is a role of diet and exercise in weight loss. I'll come to it. But why there is failure in most of the cases, I would like to explain by this phenomenon. Someone who is having more weight is on top of the wheel. He reduces weight, the motivation is lost or the aim is achieved, exercise is stopped, the dieting is stopped, and he puts on the weight back again. So it goes on in circle and circle. Person keeps on gaining and losing weight. So this was a study which was done in New England Journal of Medicine. It was published in 2011, where they have asked few patients to be on weight loss diet, and they have seen that hormone ghrelin, the levels increase. And this is the exact reason why people who eat less, uh, in spite of fasting, their ghrelin levels are increased, which remain increased. And once their fasting period is over, they tend to eat more and they tend to put on the weight more. Although I'm not a dietitian, since we are covering the weight loss topic, I would like to deliberate a few tips regards to diet, exercise. So these are some of the advices that one needs to follow when you're buying food products. Please read the food labels. There is a lot of information which is hidden away. Once you just see the food label, you will understand what preservative, what sugar is used, what is the calorie content, what is the nutritive value of the food. And any sauces or dressings or for salads will have energy dense content. So avoid these sauces. Breakfast is the most important meal of the day. Try to avoid skipping it. The way you are cooking food makes a lot of difference, and it is a proportion that makes it healthy or unhealthy. It's okay to have sweets at some point, but if you're having a large quantity versus a very small quantity, it would make a big difference. So uh, these are some of the few tips you can follow. You can inoculate, since you are all of you are young. It is easy to inoculate it right now rather than doing it later once there is weight gain. Having small frequent meals, avoiding television or mobile while you're having food, uh, and you have to correlate the food with your hunger surges. So if you don't eat when you're hungry, you eat some snack at that time, and then you'll again have your food. So you tend to eat more. So avoid that. Have proteins and fruit before your meals. And of course, these are small tips that we advise to our patients. Even just a small thing by reducing the size of your plate would reduce your food intake by almost 20-30%. So try to do that if someone is obese. If you're feeling hungry at odd times, try to ask yourself if you're thirsty or hungry, because sometimes the brain gets confused whether it's thirst or hunger. So If you are hungry at odd times, first have a glass of water or two, and then if you are hungry, you can go on and have some food. So these are food labels. Go into the details and try to understand the reason one should not go for crash dieting. That is, there sometimes we do see people who are uh, time bound. I mean, they want to lose 5 to 10 kgs in next 10-15 days because there's some marriage or function or some other reason, beauty contest probably. So in such situations, they go in for crash dieting, reduce weight, try to reduce weight drastically, which is not a good thing. If you are taking something to purge yourself, which generally happens with crash dieting, you'll be dehydrated. It is not weight loss, and you would put on weight drastically again back, after that phase is over, because the diet that you are following would not be an ideal way to lose weight. So these are some of the examples of food labels where hidden sugars in the form of these many sorbitol, fructose, maltose, lactose, mannitol, honey. These are all sugars. So try to avoid food products which have these hidden sugars. Avoid refined food, and try to have food which is rich in iron, calcium, vitamin, and fiber. These are some of the examples of food prototypes which are rich in iron, calcium, B12, folic acid, and vitamin D, which are essential for normal development of us. Fiber again is very important. The fiber comes in the form of vegetables, fruits, and salads. So this gives a sense of satiety to us, decreases constipation, improves the blood parameters. So trying to have at least 30 grams of fiber daily minimum in the diet. These are some of the foods which are rich in calcium. Try to inoculate this in daily diet. 300 grams of vegetables and 100 grams of fruit is essential. And as I mentioned earlier, fruits and proteins are required to have a sense of satiety and reduce down on food intake. Teaching and training are important aspects of weight loss. If someone at home is obese, these habits need to be inoculated into children so as they would not be obese. So teaching and training is an integral part of obesity management. Something about exercise. 150 to 300 minutes of exercise per day is mandatory for WH by, as mentioned by WHO, to have an healthy uh, good health. All forms of exercise, be it aerobic, weight training, flexibility exercises, resistance training exercise, yoga, one needs to have a mix of all these exercises. Let me tell you, yoga is for flexibility. It doesn't much help in weight loss. What really works for weight loss is aerobic or weight training. So those who have joint pains, swimming or cycling is good for them. Back strengthening we all require because we have a lot of sitting work, especially students and office work people also. So there are lots of apps which are available online for weight loss. You can enroll into any of these apps, put in your basic data, and start your weight loss program. So along with it, it's not only about diet, exercise, and right lifestyle, avoiding sleeping regular times at night, having adequate sleep of 7 to 8 hours, and rest of the things are essential to have a good weight loss. Uh, as I mentioned, quality of sleep is also important. Snoring is bad, and sleep hygiene has to be followed. Uh, Good if someone is sleeping less and is obese. One of the major changes that needs to be done is sleeping on the right time and getting on the right time, having adequate sleep. Weight loss monitoring is also important, but one should not get into the habit of checking the weight daily. because that would lead to frustration, depression, and the person would give up the weight loss attempts if he's doing too much, too frequently. Having a dietary log daily can help you in weight loss monitoring, whether it is going on the right track or it's deviated from the right track. You can monitor this yourself or via some expert who is dealing with this, who can bring you back on right track if you are not losing weight, or if too much of weight is lost, it needs to be corrected as well. So at our clinic, we do have a non-surgical weight loss program wherein there is dietary guidance, there is exercise guidance, and there is lifestyle changes guidance, wherein uh, weight loss can be achieved to the tune of 10%. So some celebrities put up, they have lost enormous weight. Let me tell you, this is not possible non-surgically. Pharmacotherapy does help in weight loss, but only 5 to 10% of weight loss is achieved with medicines. If someone who is 100 kgs, he would not lose more than 10 kgs. The meaning of 5 to 10% is of total weight. So someone who's not losing more than 5% weight at 3 months, he needs to either stop or change his medicines. So coming to the surgical management, when we are speaking about bariatric and metabolic surgery, the BMI where we operate is about 32.5 if a person has diseases, or 37.5 and above without diseases. And for people who have uncontrolled diabetes or hypertension, we operate about 27.5 BMI. So in my earlier part, I did mention you all that up to 23 is normal. So 23 to 27.5 or 23 to 32.5 if there is no disease which is uncontrolled, there is a definite role of diet, exercise, and if required, medicines. And there are some non-surgical options, I'll come to it. But 23 to 32.5, there is very minimal or no role of surgery. It is all diet, exercise, lifestyle management, and non-surgical options. Beyond 32.5, we prefer to operate. The reasons I'll tell you. American Diabetes Association has accepted bariatric surgery as a valid treatment option for diabetes. This might be something new for you all, but if a person has type 2 diabetes, he can be cured or his diabetes can be improved with bariatric and metabolic surgery. We do not do these surgeries in people who are unmotivated to do anything except for surgery, and people who are chronic alcoholics or have severe psychiatric illnesses. So in a sleeve gastrectomy, what we are doing is, this is the food pipe, this is the stomach. So we are reducing the size of the stomach. We are removing this part of stomach, which is known as the fundus, which secretes an hormone known as ghrelin. So once we have removed this part, even if the person eats less, he would not feel hungry as opposed to diet and exercise. So that is how this person would lose weight, which is up to 70 to 80% of his excess weight in a year. So as I mentioned earlier, if a 5 feet person who should have 50 kgs as his ideal weight, if he is 100 kgs, he would be excess of 50 kgs. So with this surgery, 70 to 80%, that is 35 to 40 kgs, this person would lose in a year. This is a surgery which is based on changes in hormones, be it GLP-1, PYY, or ghrelin, and that is how we get the end result. And people lose up to even long term, 5 to 8 years. These are the long term results. 50 to 60, 65% of weight loss you are seeing, 60 to 80% of improvement in diabetes is seen, and this is another variation to the sleeve gastrectomy. This is known as mini gastric bypass, wherein we do make a small pouch of the stomach and we attach a small intestine to this. Thereby, the food is diverted into the small intestine directly. Patient need to take some supplements after this surgery in the form of protein, calcium, vitamin, folic acid, calcium, and minor elements. So these are published reports of patients who have 10-year results after bariatric surgery, and the results are quite encouraging. It's been in India since 2005, and it's been covered under insurance also now, because the insurance companies also have understood the utility of bariatric surgery in reducing weight and controlling the diseases. So this is a non-surgical treatment option, intragastric balloon, wherein we insert a silicone balloon inside the stomach, which is filled with saline, which remains in the body for a year, and after that we remove this. This is useful for, especially for young unmarried females who wish to lose 10 to 15 kgs and who have tried everything and failed at losing weight. So this is a reversible procedure, and this is a daycare procedure. We admit and discharge the patient on the same day. So this is an addition to diet, exercise, lifestyle changes, medicines. This is a non-surgical treatment option. Then along with all this, we also have support group meetings where we conduct and guide these patients about uh, weight loss. So support group meetings are based on the concept of sharing and caring, where people with common problems come together, share their issues, and find a way out with guidance of an expert. So we do conduct these meetings every 3 monthly or 6 monthly, and this coming 24th, next Saturday, we are having this such kind of meeting. Those of you whoever may be interested in weight loss can join to this meeting and learn more about it. Unfortunately for us, patients with the fear of surgery, they uh, avoid surgery, and with results, I mean, you can see the spine is having issues, the knee is having issues, they cannot walk, then they come for surgery. So it is all about individualized treatment. The right kind of treatment has to be chosen and given to the right person. Unfortunately, people go in on internet and download meal plans and try to inoculate that and fail at it. So if this weight loss is guided by an expert and a right kind of treatment is given to the right person, the results would be very good. You should be taking information from person who is technically and competent enough to handle the problems and issues. And before I end my talk, I would like to explain that green tea, which is a common thing that people do, just hope that they would lose weight by drinking green tea, all their problems would go away and the weight would reduce. They would probably have to go to the hill to pick it up, only then they would lose their weight. So we do have a team of qualified, trained dietitians, exercise consultants, lifestyle experts, and it is an individualized care. It's not a blanket treatment given for all people. And support group meetings, as I mentioned to you, we conduct these daily, regularly. So these are the various links where you can learn a lot about this surgery, the non-surgical options, the diet do's and don'ts. And this is my YouTube channel, Dr. Kedar Patil, where you'll get to learn about a lot. It's mainly focused and for patients and laymen, where you can learn about laparoscopic surgery, weight loss, bariatric surgery, hernia, gallstones, and abdominal diseases. It has 32,000 subscribers and is growing. And the website is livedocs.india.com. The YouTube channel is Dr. Kedar Patil. So you are most welcome to go to these and learn more about these issues. Once again, I thank you all for inviting me for this health talk, and I think I'm done with the presentation. If there are any questions, so any questions that you have, or
Yes, sir. We
anything?
have some questions.
Yes.
So my question is, does cardio workout give the best results?
See, as I told you in my lecture, it is not a single exercise that would mix of all kind of exercises, be it aerobic, weight training, or flexibility and resistance training. So cardio, yes, will give you weight loss, but doing cardio alone is not sufficient. You need to inoculate rest of the exercises as well.
Can bariatric surgery help improve any existing health conditions such as diabetes, high blood pressure, high cholesterol, or sleep apnea?
Yes, of course. About 60 to 80% of diabetics have an uh, improvement in their diabetes status. A good number of them would, if they are on oral hypoglycemic agents, their medicines would stop. If they are on insulin, they would be shifted to medicines. Number of medication would reduce. The complications of long-term complications of diabetes would reduce. So overall, for diabetes per se, if you ask me, the results are very good, uh, followed by hypertension, sleep apnea, PCOD, uh, joint pains, hyperuricemia, hypercholesterolemia. So all these conditions are improved with bariatric surgery.
So my next question is, why do women after age 40 struggle more with weight loss and at menopause?
See, it is puberty and menopause are important phases. Puberty and menopause are important phases in life of a woman where there are a lot of hormonal changes happening in the body, especially with progesterone, estrogen. So, because of these hormonal changes, they tend to have weight gain, which is normal. In addition, pregnancy is a condition which would be natural to have weight gain. So, but there is also weight loss after pregnancy when a female is feeding a child. So, weight gain and loss is a natural part of any female reproductive life, be it at puberty or menopause. What is important is a clear understanding of what is happening with the body so as to avoid the weight gain. Generally, weight gain will not be at puberty, weight gain will happen near menopause. So, that is the time, especially after 35, all females need to be actively involved in their own health self care. They need to have routine gynec checkups. They need to have advice by the gynecologist with regards to the weight loss, with regards to their reproductive life, and with regards to vaccination, breast self examination. So there are many things that you need to understand from gynecologist and healthcare providers. So it is a good idea to have an annual examination after, especially after 35.
Sir, sir, does drinking water help lose weight? If yes, then how?
Not really. Drinking water doesn't help lose weight, but what it does, it as I told you, if you're feeling thirsty at odd hours or you're feeling hungry at odd hours, and you drink water, you would reduce down your caloric intake. So in that sense, it may, but per se, just drinking water will never help you lose weight.
How will the surgery help me lose weight? How much weight can I accept lose? Is it likely that I will regain weight after surgery?
Looking at you, I don't think you require. can definitely lose 60 to 80% of his excess weight with bariatric surgery. So it is a foolproof method of weight loss, I would say. But again, the take-home message would be surgery does good, but to maintain that lost weight is entirely up to the candidate. Uh, to inoculate good diet, exercise-related habits, lifestyle changes. This is also important part after bariatric surgery.
So I'm done with my question. Thank you so much, sir. It was really a great and informative session. I was a pleasure to have you, sir. I once again thank you, sir, for behalf of our audience.
Thank you all. Thank you SRWC and SGR Knowledge Education Foundation, Raisoni College, and both of you. Thank you all.
Thank you so much.